Hello, everyone. My name is Sarah Murray. I'm one of the dietitians with the Villages Health, and today we will be talking about nutrition for chronic kidney disease. So just some objectives that we're going to go over today. We're going to go in depth about the causes of kidney disease, the relationship to diabetes and to heart disease. We're going to be talking about why the kidneys are even important to start with, what's the purpose of the kidneys, what do they do for our overall body. We're going to look at the functioning of a healthy kidney versus a non-healthy kidney, and the detection of kidney disease. So how your doctor even knew that you had kidney disease, how you were given this diagnosis, or how someone is given this diagnosis. Of course, we're going to go over the nutrition for kidney disease. Specifically, we're going to go over the early stages and then some components that you might want to think about in the later stages of kidney disease as well. So sodium, potassium, phosphorus, and protein are all things that you might want to start thinking about, whether you're in the early stages or in the later stages. Specifically, in the later stages, there's a lot more components to try to think about, so we just like to keep it as simple as possible. We'll go through all of that. We're going to talk about some vitamins and minerals, the first steps after diagnosis, and then look at some resources for you guys as well, and talk about those. So kidney disease, it is a growing healthcare concern. 1 in 3 Americans are at risk of developing kidney disease. That's a huge portion of the population, obviously. And 30 million Americans are affected by kidney disease. That's 15% of the adult population. 90% of those who have kidney disease don't even know that they have it, though. So that's something that's kind of, you can be seen as a good thing or a bad thing. If you think about it, these people, of course, have a disease that they don't know about. They could maybe be doing something to try to decrease their further risks of the disease or manage it better. But also people are walking around with no symptoms with this disease. So you're able to live out your activities of daily life without it inhibiting you so much that you are going into the doctor and really, getting checked out for that. So it can be seen in both ways, but definitely if you have it, you want to know that you have it, of course. It is the 9th leading cause of death in the U.S., and this is another one that can be seen in both lights as well. Kidney disease is often an underlying cause of things like heart disease. It can even cause fluid overload, which can put extra pressure on your heart, which could ultimately lead to a cause of death in that way. So I always think that even though it says it's the 9th leading cause of death, that could be off due to other factors that the kidney disease could have been a complication of. Diabetes and high blood pressure are the 2 leading causes of kidney disease, and once the kidneys fail, dialysis or transplantation is required. So you have to have that function of the kidneys done in some way, and you can get that done through dialysis, so outside of the body, or a transplant of a kidney, so having an additional kidney placed in your body, and it does it from the inside. So this is a chart to give you an idea of when you're at that end stage of kidney disease. This is also known as end-stage kidney disease, stage 5 kidney disease, also known as kidney failure. They're all synonyms for that same stage of kidney disease, that last stage of kidney disease. There's 5 stages of kidney disease. So 44% of end-stage renal disease is caused by diabetes. So a huge portion of the pie there is due to diabetes. The next biggest portion there, that's hypertension or high blood pressure. So 20% of those with end-stage renal disease have it because of high blood pressure. And you can assume, too, if you combine those two, if you have diabetes and high blood pressure, that really puts you at a larger risk of developing that end-stage renal disease, a huge portion of the pie there. 19% is due to other or unknown causes. That could be anything from excess toxins, so drug usage, NSAIDs. It could be due to renal cell carcinoma, so kidney cancer. It could be due to an acute kidney injury that led to kidney disease. So, whether that be an injury physically, you get hit or you get in a car accident or something, or it could be something acute like a stone that gets lodged and causes a kidney injury, eventually leading to kidney failure. 8% is due to something called glomerular nephritis. That is an inflammation of one of the functioning units of the kidneys. I'll show you the inside of a kidney in a few slides here so you can see from the inside how inflammation can really make a big difference. And then 2% is due to cysts, the majority of that being due to something called polycystic kidney disease, which is an inherited disease. So if you have it, someone in your family likely had it and passed it down to you. So 2% is due to that. So these are all of the different risk factors for kidney disease. So you can see why 1 in 3 Americans are at risk of developing kidney disease. So if you're above the age of 60, you're already at risk of developing kidney disease. Some family history, like I mentioned, polycystic kidney disease is one big one there. Certain ethnicities are more likely to develop kidney disease. African Americans are 3 times more likely to develop kidney disease than other ethnicities. So Hispanic Americans are also more likely, Asian and Pacific Islanders and Native Americans are all more likely to develop kidney disease. Diabetes and hypertension, like we were talking about, heart disease, kidney stones, smoking, and obesity, they're all risk factors for developing kidney disease. And like we saw in that pie a little bit earlier, diabetes is the #1 leading cause of kidney disease. And just some statistics, 30% of patients with type 1 diabetes and 10 to 40% of those with type 2 diabetes eventually suffer from kidney failure or that stage 5 kidney disease. And that's a pretty big range for those type 2 diabetics. So 10 to 40% of those with type 2 diabetes suffer from kidney disease or kidney failure. And that's due to how well they're actually managing their blood sugar, how well they are they checking their blood sugar every day? Are they keeping it within goal? What's going on there? So anywhere from 10 to 40%. And also if you think about blood sugar management, so if you have elevated blood sugars, those elevated blood sugars can do damage to all of the blood vessels in your body, including those sensitive little kidney blood vessels. So that can do damage in that way, but also if you think about diabetes causing nerve damage. When you think about the nerves being damaged, it can cause you to not be able to realize that you need to go to the restroom. So, emptying your bladder, that can eventually lead to a UTI if you're not emptying your bladder regularly enough, and that can back up into a kidney infection, going all the way up the uterus and into the kidneys. So that can lead to kidney disease in that way. So a double whammy in that way for diabetes, a couple big ones of why we want to focus on getting that blood sugar under control. Heart disease, like we saw, high blood pressure is the #2 leading cause of end-stage kidney disease, and it's something that we really want to focus on, making sure that cardiovascular health is really there when you have kidney disease or at risk of it. So if you're getting your labs done, if you're getting your lipids done, making sure you're getting those at least yearly. Most people get them done if they're over the age of 60. They're getting it done twice a year, so every 6 months. So knowing what those numbers are and knowing what to actually shoot for those numbers. LDL cholesterol, that's your bad cholesterol. We like to say that L stands for lousy, so you can know LDL is lousy. That's the bad one. We want to keep it low. So we want that one to be under 100. The HDL cholesterol, we say the H stands for happy, so we want to keep it high. So we want that one ideally for females to be above 60, ideally for men to be above 55. Cholesterol, that's the total cholesterol there, just keeping it under 200. And triglycerides under 150. And different things as far as diet management goes affect different numbers here. So the LDL cholesterol, going back up to the top there, that lousy cholesterol, the biggest impact as far as food intake goes is going to be from saturated fats. And saturated fats are largely coming from your animal proteins and your animal fats. So if you think about like cheeses, for example, butter, creamy sauces, animal proteins, especially like your fatty cuts of meat, they're going to be higher in saturated fats. Your HDL cholesterol, the best way to keep that one up, that happy cholesterol, is physical activity. That makes a huge difference there. So keeping up that physical activity. The standard recommendation for physical activity is at least 150 minutes every week of getting your heart rate up to that moderate intensity level, so getting yourself out of breath a little bit. And at least 2 days of some kind of strength or resistance exercise. So asking yourself, am I hitting that physical activity goal? And if not, how can I actually try to hit that goal a little bit closer? Your triglycerides are impacted mostly by your carbohydrate intake. So that one and diabetes tend to go hand in hand. So if you've got high blood sugar, your triglycerides might be elevated. So keeping that one in mind, sugary foods tend to increase the triglycerides quite a bit. So why are the kidneys so important? Why are we even listening to this? Why do we care about the kidneys? The kidneys are basically act as a filter for our body, so you can think about it as like your water purifier, filtering out all of the water and then giving you the good water. So it's basically filtering out all of the blood in your body, getting rid of the waste products. So it's you're urinating out the waste products, the excess fluid, and you're keeping the good stuff in the blood. So it gets rid of the extra waste and that excess fluid. And that way it also helps to regulate different electrolytes and the acid-base balance in your blood as well. So sodium, potassium, acid-base levels, just to give an example there. It also helps to produce hormones that affect your function of other organs too. So it helps to regulate your blood pressure. It helps to keep your bones strong by creating the active form of vitamin D. And it also helps to create red blood cells. So that hormone that creates red blood cells is really important for your kidneys. So just a few reasons why we love those kidneys so much and we want to keep them going. And if you're a visual learner, I really like these next couple of slides. They're showing you the structure of the kidney. So basically, most people have two kidneys. They're about the size of your fist. They're about the lowest rib cage level, the lowest rib towards your back. So if you hold your fist up to your back, they're about right there. And they're part of the urinary system. So like I said, all of the blood circulates through the kidneys, and then that urine, those waste products, that excess fluid goes down the ureters into the bladder. Your bladder will hold about a cup or two of urine before you urinate it out through the urethra. And this is a view from the inside of the kidneys. So this is just one kidney here, and as I said before, it's about the size of your fist. So if you can envision this is about the size of your fist. And then you can see one nephron, that's one functioning unit of the kidney. And one nephron, we have about 1.3 million nephrons per kidney. So if you can imagine how small a nephron must be if you have 1.3 million in the size of your fist, and that's just one kidney. And then you can see the glomerulus up there is that little red capillary mass right there. And the glomerulus, remember how I said that glomerular nephritis, that's when you get that inflammation of the glomerulus. So that would be inflammation of that little ball of capillaries right there. So you can envision how that would decrease your kidney function. So the glomerulus, that's where you get a lot of blood. That's where your blood is really being filtered out quite a bit, and then your body's kind of honing in on it throughout the rest of that loop. It's really just making everything more balanced throughout the rest of the loop, but it starts with that glomerulus. So all of your blood is flowing through the glomerulus, and you have 1.3 million of these, remember, per kidney. So all your blood is going through these tiny little capillaries. So you can imagine as well how elevated blood sugar or elevated blood pressure might throw off how well these can actually filter out that blood. So, or how they can get injured as well. So just thinking about that, I'm more of a visual person, so I really like this visual. 1.3 million of these per kidney, size of your fist. You can imagine how tiny they are. They can get injured really, really easily. They're quite sensitive. And you have about 200 quarts of blood being filtered through your kidneys in a day, and you're creating about 2 quarts of urine per day per kidney. So they're very busy all day. So in a healthy kidney, you're going to get that sodium and water removal appropriately. You're going to get that proper waste removal and that proper hormone production. However, in an unhealthy kidney, you're not going to get that proper water removal. You're going to have fluid overload. You might be retaining more of that fluid. You're going to get elevated waste products in the blood because your kidneys are not getting rid of those waste products like urea, creatinine, potassium. You want to get rid of them, and they are not being regulated. And then you're going to have changes in your hormone levels as well. So you might have issues with monitoring your blood pressure. You might have issues with making of red blood cells, so you might become anemic. And you might have issues with the uptake of calcium, which is going to affect your bones. So symptoms of kidney disease, these are typically at the later stages of kidney disease. You typically won't see these until you're about stage 4 or stage 5 kidney disease. But fatigue, low energy, trouble concentrating, poor appetite, trouble sleeping, muscle cramping and twitching, especially at night, shortness of breath, swollen feet and ankles, puffiness around your eyes, especially in the morning, dry, itchy skin, and then needing to urinate more, which is kind of ironic if you think about it. You need to urinate more before your kidneys just stop working altogether. So you're urinating, and then all of a sudden you're no longer producing urine at all because your kidneys are not producing it. So kind of ironic in that way, but those are some symptoms just to be aware of. Detection of kidney disease, so how did your doctor even know that you had it? What do you look at on your labs to see how well your kidneys are working? There's a couple of different tests that we look at for this one. One is called microalbumin, and this is done by testing your urine. So if you think about that word broken up, that albumin word, that's a protein that we have in our blood, and we actually want to keep it in our blood. So that's a protein that we want to keep in the blood. So when they're checking your urine, they're checking the amount of albumin you have in your urine. That's a protein that you do not want in your urine. You want it in your blood. So if you have albumin in your urine, and it's too high in albumin, that means that your kidneys aren't working well. There must be some damage going on there. The GFR is another one that they'll check, and this one's actually important for staging your level of kidney disease. So oftentimes when you're looking at your lab values, this one is going to have an E in front of it, the letter E, and it stands for estimated. So it's the estimated glomerular filtration rate. It's basically telling us how well your kidneys are filtering out your blood. So the higher the number, the better. And this is a blood test, and it's calculated based on your age, your race, your gender, and your blood creatinine level. There's nothing we can do about your age, your race, or your gender, but your creatinine level is something that is modifiable. That's the one that we want to look at there too. So oftentimes if you see the creatinine is elevated, you'll see that the GFR is low. So this is how the staging is done with the GFR and telling how well your kidneys are working. So stage 1 is a GFR of 90 or above. Stage 2 is considered a GFR of 60 to 89. And stage 3, that one's actually broken up into 2 different stages, stage 3A and stage 3B. And they did this on purpose. I'll go into that in just a second here. But stage 3A is a GFR of 45 to 59. And then stage 3B is 30 to 44. So they noticed that stage 3, if your GFR is 45 or higher, people tend to float around a lot more as far as their GFR levels go. These numbers tend to, you could maybe go up into stage 2 or go back down to stage 3A. People tend to float around a lot more. This number tends to indicate that they don't have so much damage done that it can't be reversible. So if you're in stage 3A, our goal is typically to try to increase that GFR as much as we can and get it back into maybe stage 2 again. If we can stage 1, that would be wonderful, but stage 2 at least. Stage 3B is when we notice that people tend to stay pretty stagnant, even if we're making dietary improvements and doing everything we can. Our goal is just to preserve that kidney function. So we want to make sure it doesn't go down too much more. So between 30 and 44 and lower, we just want to preserve what kidney function we do have. I mean, it would be an outlier to say that we can get it to increase again, but it wouldn't be unheard of. But our goal is simply to just preserve it. Realistic goals here, preserve that kidney function. Stage 4 is a GFR of 15 to 29, and this is considered a severe decrease in the kidney disease. So this is when you might start to experience those symptoms. Stage 5 is a GFR of 15 or lower, or if you're on dialysis, this is considered kidney failure or that end-stage kidney disease. So if your GFR drops below 15 is when they're typically start to talk to you about dialysis and getting ready for that. So treatment, most kidney disease can be treated through medical and nutrition management. So we want to see what we can do as far as making any kind of lifestyle changes that we can make. We want to see if there's anything that we can do as far as medication changes. And most people can have success with that. And we also want to see what we can do as far as those other disease states. Like I was saying, that diabetes, number one leading cause of kidney disease. How well are we managing those blood sugars? Can we get that better improved? Can we get the blood pressure better improved? And then also thinking about that progression, if you do get to the point of kidney disease, we need to replace that function of the kidneys, whether that's externally with dialysis or internally with a transplant. So why is good nutrition important? We should all know why nutrition is important, right? It helps us to provide energy for our daily tasks, helps us to prevent infection, helps us to avoid the loss in muscle mass, helps us to maintain a healthy weight, and it can also slow down the progression of kidney disease. So thinking about where we might have room for improvement when it comes to kidney disease and our overall nutrition. If you're doing everything perfectly already, which, most of us have a little bit of room for improvement, but if you're doing everything perfectly, there's nowhere we can really go as far as kidney disease. So we hope that we have at least a little bit of room for improvement, that we can maybe increase our kidney function a little bit more if we're stuck with this kidney value right now. So thinking about little things that you can do every day to really make a difference. And we'll go through all of those now. So this is pretty much everything I just went over. I'm not going to reread it all. But if you think about your kidneys, they are getting that mineral balance in your body. So if you think about things like potassium and phosphorus, your kidneys are helping to get rid of those. So if you have elevated potassium and phosphorus in your blood, we might need to decrease potassium and phosphorus in your diet in order to get those numbers looking better, make up for the kidneys not working well. But that one's not applicable to everyone. Most people with kidney disease, if they're at those early stages of kidney disease, sometimes even stage 4, they don't have issues with potassium or phosphorus in their blood. So this is where individual nutrition therapy comes into play. There's no one such thing as a kidney-friendly diet. So if you Google kidney-friendly diet, you're going to get something that's made for people who are at the last stages of kidney disease, that end-stage kidney disease, where they need to maybe limit their potassium and phosphorus and calcium, or whatever it might be. It's not applicable to everyone. So this is why it's so important to get that individualized nutrition therapy. And if you have stage 3 or higher kidney disease, your insurance will likely cover for you to meet with a dietitian, so you can get that individualized nutrition therapy. And it's all going to be individualized based on your labs, and it's going to be individual based on your labs at that moment. So what do your labs look like? What do your latest labs look like? What have your labs looked like in the past? What you can and cannot eat might change over time. So, what you can eat 1 month might change 3 months from now. So that individualized therapy is really important for kidney disease. And that is, again, pretty much everything I just went over, but we're going to go through all of that right now. So I don't know how many of you like to look at this nutrition facts label, but this is very helpful. This is a very wonderful tool when it comes to healthy eating, especially when it comes to managing kidney disease. So just to review here, you might be familiar with that nutrition facts label over here on the left. That's the original label that came out in the 90s. The new label over here on the right, this came out as of 2020. They had to roll these out. So you might start to see more and more of these new labels come out. And there are some changes here that are going to be important. So the very first thing that you should look at when you're looking at your food label is labeled number 1 up there. This is the serving size and servings per container. This is really important because it sets up the basis for everything under it. So none of the things below make any sense or mean anything at all if you're going to eat all 8 servings of this food. So by all means, look at that serving size. It says 2/3 of a cup of this food, or if you were to put it on a food scale, it'd be 55 grams of this food. It's going to be 230 calories. So you can see the calorie amount right there. It's big and bold now. We can't really miss it. The calories are coming from your fat, your carbohydrates, and your protein. So technically, if all of those are within balance, then you don't necessarily have to focus on the calories amount, really focusing on the balance of fats and carbs and proteins, and making sure you're within your goals there. So you have the fat that's listed there next. This food has 8 grams of total fat, 1 gram of saturated fat, and 0 grams of trans fats. So you might be wondering now why this doesn't quite add up. So you have 8 grams of total fat, 1 gram from saturated, 0 grams from trans fats, but where are the other 7 grams coming from? It doesn't add up. The other 7 grams are coming from unsaturated fatty acids. So they're coming from our poly and our mono unsaturated fats. These are cardioprotective fats. They're heart healthy. So when you're looking at the total fats, we really aren't too focused on that number right there, but we're more so focused on how much saturated fat is in the foods. The lower saturated fat, the better. We want to avoid eating too much saturated fat. That's what can impact that LDL cholesterol that I was mentioning earlier. Trans fats we want to avoid altogether, so you want to see that 0 trans fats right there. Cholesterol is listed under there. This is not exactly the same thing as the dietary, cholesterol that you have in your blood. The dietary cholesterol is typically absorbed in the colon before it even hits your bloodstream. It competes with fiber for absorption. So if you're eating a diet high in fiber, which we hope that you are, the cholesterol is actually not going to be absorbed, so it's not going to impact your blood cholesterol. The saturated fat, on the other hand, will have a bigger impact on your blood cholesterol. Sodium is definitely something we want to pay attention to for kidney disease, and we'll go into that one more in just a minute here, but that's an important one. We see 160 milligrams per serving of this food. But again, thinking about, okay, there's 8 servings per container of this food. How much of this food am I actually going to eat? Total carbohydrates, that one's really important for especially blood sugar management. So if you do have diabetes, you should have a number in your head of how many total carbohydrates you should eat per meal or per snack, knowing what that number actually looks like for you. So 37 grams of total carbohydrates for this food. From that, you've got 4 grams of fiber, 12 grams of sugar, 10 of those 12 grams of sugar are added by the manufacturer, so something else to keep in mind there. But again, things don't add up here, so you actually have starch that's also being added to the total carbohydrates, so it's not necessarily listed on the food label. So you've got 4 grams from fiber. The more fiber, the better. The total sugar is 12 grams of total sugar, 10 of which are added by the manufacturer, which is a new addition to the food label there, but it's very helpful to see the quality of the food that you're actually looking at. So 2 grams of natural sugar in this food, 10 grams are dumped in by the manufacturer. And then you can see the protein there on the bottom too. We do want some protein with each meal, but we don't want to go overboard on protein. We'll go into that in a minute as well. You can see some of the minerals and vitamins are changed on the bottom here as well. So we kept calcium, we kept iron on the food label, but we did take out vitamin A and C. We replaced it with vitamin D and potassium. That potassium is really important for people with kidney disease as well, because it's something that you might need to limit in your diet. We'll go into that more in just a minute as well. And then also, we got rid of that confusing chart on the bottom of the food label that no one ever paid attention to. So we kept it simple so we could have room for more important things. So just a quick overview of the food label. So one of the most important things that you can do for your kidneys is to stay adequately hydrated. Where approximately, that should change, it should say about 50 to 70% of your body weight is water. So we're about 50 to 70% water. Just by being humans. So it's really important to make sure that you're replenishing that fluid in your body and your body is well hydrated. That's really important for keeping your kidneys to function better. Studies show that even mild dehydration over time can lead to kidney damage. So really important to make sure you stay hydrated, especially if you have something like diabetes, where if you have elevated blood sugar, that can lead to increased excretion of urine. So that's something to keep in mind there too. You're more likely to be dehydrated, which is going to decrease your kidney function. If you're sick and have any kind of diarrhea, vomiting, or if you're exercising, you're sweating, thinking about replenishing those fluids, really important there. So one way to check out your fluid is by checking your urine when you go to the restroom. And of course, that can vary by how much fluid is in your bowl. But thinking about that in terms of just a baseline, check out that urine when you go to the bathroom. You're the only person who's going to check, so by all means, check it out. You want it to be lighter. The lighter, the better. You don't want it to be completely clear, but you do want there to be a light tint there. So when it comes to hydration, the standard recommendation is that 64 ounces of water a day. If you're going to be exercising, like I said, maybe increase it up to 80 ounces a day. So that would be 8-ounce glasses, 64 ounces. If you had a 16-ounce water bottle, it'd be 4 bottles of water. So trying to make sure you're checking that baseline, you're making sure you're getting at least 64 ounces of that water a day. And technically, anything that is calorie-free and decaffeinated is going to count towards hydration. So keep that in mind too. If you need to flavor your water in any way just to get to that 64 ounces, as long as you're not adding anything with calories or with caffeine, you can count that towards your hydration goal. Sodium is something else that you definitely want to pay attention to with kidney disease. Excess sodium in the diet has been linked to kidney inflammation, which is obviously going to decrease the functioning of the kidneys. And also, it can cause fluctuations in your blood pressure, which is going to decrease your kidney function as well. So thinking about the sodium that you're eating throughout the day, it's not always coming from the salt shaker. It's not always coming from the table salt, but it's oftentimes coming from our processed and pre-prepared foods. Statistics show that about 70% of the American sodium intake is coming from processed and pre-prepared foods. So it's not always that salt shaker that's going to be the biggest culprit. So I encourage you guys to look at the sodium on your food labels like we saw just a couple slides back. The recommendation for kidney disease is no more than about 1,500 to 2,000 milligrams of sodium per day, but a dietitian can give you your specific recommendations. So thinking about ways that you can decrease your sodium, because the typical American is eating about 3,600 milligrams of sodium a day. So much more than the standard recommendation that we're offering up here. So 1,500 to 2,000 milligrams of sodium a day would be the goal. Some people find it helpful to shoot for about 400 to 600 milligrams of sodium per meal. However you want to break it up, thinking about how that sodium might be consumed in your diet. If you're going out to eat or something, that's often a very high sodium meal. So making sure you have plenty of sodium in your bank left over for whatever meal you might be dining out, or if you're eating out earlier in the day, thinking about what else you're going to eat that day that's going to be lower in sodium. Trying to think of different ways to spice up your foods. It can take a little while for you to get used to the lower sodium taste of foods, but it is something that your taste buds can become acclimated to. It can take about 3 weeks for your taste buds to turn over, so try to be patient with yourself when decreasing that sodium in your diet, but thinking about ways that you can add flavor to the food without adding that salt. Herbs, spices, different ways of cooking like grilling and slow cooking can release natural flavors from your foods. Adding herbal foods like onions or aromatic like garlic, ginger, different flavors that can really flavor up a dish without adding extra salt. And reading your food labels carefully. So when you see something that's a reduced sodium food at the grocery store, that doesn't mean that it's a low sodium food. It doesn't mean that it's a very low sodium food. Very low sodium, these are regulated claims here. So very low sodium means that the food has 25 milligrams of sodium or less per serving. You'll typically only find these on like vegetables and things like that. Low sodium is considered 140 milligrams of sodium or less per serving. So that means, it's really not too bad in sodium as long as you can stick to a serving size. But like I said, if you're going to eat 8 servings of the food, it can really add up. Reduced sodium simply means that the food's reduced by 25% from the original food product. So the original food product, like the original can of soup, could have had 1,000 milligrams per serving. The reduced sodium still has 750 milligrams per serving. That's still quite a bit, especially if you're going to eat a whole can of soup, which might be 2 servings. So keep that in mind. Looking at the sodium content of the foods, actually flipping your foods around and looking at the sodium in milligrams that's listed in the food versus going for the reduced sodium claims. Like I was saying, when you're eating out, it's really easy to have a high sodium meal then, and most of those meals are higher in sodium just by the way that they prepare them. And it can be helpful to think about how you might be able to manipulate the foods that you're ordering, asking for sauces and dressings on the side, trying to get the lowest sodium plate you can get because it's probably still going to be pretty high in sodium. Being careful with salt substitutes is really important as well if you need to limit your potassium, especially. Oftentimes, these salt substitutes are going to be made with potassium chloride instead of sodium chloride, which is table salt. So being aware of that, if you do need to limit your potassium in your diet, that is not going to be a good one to go for. And a quick tip there, if salt is listed on the first 5 ingredients of a food, it's probably a pretty high sodium food, but you can always just look at the sodium content on the food label and determine that on your own. So everything here forward that we've talked about is applicable. Everything from this slide forward has been applicable to everyone with kidney disease. The side slides that we're going over in the next few minutes here, they're going to be applicable if you have ever had elevated lab values of these. So potassium, this is only applicable if you have had a high potassium in the past or have a high potassium now. So this is a specific recommendation for people, and it is not always going to be applicable to you. Talk to your dietitian or healthcare provider to see if this potassium restriction would be applicable for you. So potassium is a natural food, is a natural mineral in our foods, and it comes from a lot of healthy foods too. So if you do not need to be on a potassium restriction and you put yourself on a potassium restriction, it can be more harmful than beneficial. Many healthy foods are high in potassium. Potassium plays a role in keeping our heartbeat steady, so it helps us to stay out of AFib. If you have too much potassium in your blood, you can go into AFib and eventually maybe even cardiac arrest. If you're limiting your potassium too much, that can be more harmful to your cardiac health. So a normal amount of potassium is typically about 3,500 to 4,000 milligrams of potassium a day, and the typical American is not even hitting this value. So the typical American actually needs to increase their potassium intake. They need to increase their intake of these high potassium foods, these healthy high potassium foods. However, if you do need to restrict your potassium, the recommendation is about 2,000 milligrams of potassium a day. And again, a healthcare provider, a dietitian can give you a specific number when it comes to the potassium. So looking at your lab values is going to be essential here, looking at your blood potassium level. A typical zone, this depends on your lab's calibration, but it's typically about 3.5 to 5.0 for the potassium. 5.1 to 6.0 is typically a caution zone. It's going to be a little elevated. Anything over 6 for potassium, your doctor's probably going to send you right to the hospital. You really need to get checked out. And there are some quick tips that people do to try to reduce the potassium that they're eating without cutting out any given food. So typically when you're eating any kind of foods, if you just watch your portions of it and try to eat a variety of it, you can avoid eating an excess amount of a high potassium food. So making sure you're eating a good variety of foods, but you're watching the serving size of all your foods. Potassium is also one of those things that can leach into the surrounding liquids. So if you're buying a can of vegetables, so you're buying a canned potatoes or something, the potato will actually leach potassium into the surrounding water. So not using that water that your foods are canned in, but you can also use that in the opposite direction as well. You can leach your high potassium foods by putting them in a large vat of water and replenishing that water every now and again, and you can actually leach out potassium from your foods. So just to give you some examples of some high potassium foods, you can see a lot of healthy high potassium foods here. And like I said, the typical American's not eating enough of the high potassium foods. So like broccoli, green beans, and broccoli, potatoes, beets, spinach, tomatoes, oranges, bananas, cantaloupe, even things like chocolate, milk. Oftentimes dairy products are very high in potassium, nuts, seeds, peanut butter. So high potassium foods versus low potassium foods, this is per half of a cup. If you eat too much of anything, you're probably going to get quite a bit of potassium in the diet there. So just to give you some examples there, one thing interesting to point out is that whole grain foods tend to be higher in potassium than more processed foods. That's because when they process our foods, they process out a lot of the potassium. So oftentimes, if you do need to be on a potassium restriction, those more processed grains are going to be lower in potassium, which is ironic if you have blood sugar issues and you're told to eat whole grains, but then at the same time you shouldn't be eating the whole grains because of their potassium content. So it can get a little bit confusing, but you have health professionals that are here to help, namely dietitians. Phosphorus is one of those other things that we were saying could really add up in the blood. It's a mineral that is in your blood naturally, but if you're having issues with your kidneys and they're not filtering out enough phosphorus from your blood, the phosphorus can build up in your blood, and phosphorus loves calcium, so your phosphorus is actually going to continue to float around in your blood until it finds a source of calcium in your body. A good source of calcium in your body, if you think about it, is your bones. So it'll actually start to leach the calcium from your bones. So now you have this combination of phosphorus and calcium still floating around in your blood because your kidneys are not getting rid of it. And it's actually just going to lay down in the soft blood tissues of the body. So you can actually get a buildup of calcium in your blood vessels because of a high phosphorus level. And this is something called calciphylaxis. And it's very painful. It occludes your blood vessels, not something that's desirable, of course. So we want to avoid that high phosphorus level. Phosphorus is typically not something that your doctor will typically check for. Oftentimes, if it's your primary care physician, you'll need to request to have your phosphorus done. Sometimes they'll go ahead and do it too, though, but not often. If you're seeing a nephrologist, which is a kidney doctor, they often will check your phosphorus levels. So a normal phosphorus level based on your lab's calibration is going to be around 2.5 to 4.5. And if you do need to restrict your phosphorus, it's typically between about 800 to 1,000 milligrams of phosphorus per day. But like we saw on the food label, phosphorus is not listed on the food label. So if it's a restriction that's indicated for you, definitely talk to a dietitian and see how you can get some help with that. I'll show you guys some resources as well. So phosphorus can be found naturally in our foods, or it can be used as an additive in the foods, and it's actually been used more frequently as an additive in our foods in more recent years, which is pretty interesting. It's allowed to be used as, if you see on the food label something like natural and artificial flavors, it's allowed to be used in those natural and artificial flavors, and they don't need to actually list it on the ingredients list. So it's a very sneaky one, but you do want to look at the ingredients list of your foods to see if it's listed on there as in the terms of phosphoric acid or phosphates or anything like that. Anything with PHOS, phos, in the name is going to be a higher phosphorus food. And it's also in our animal products and our plant products as well. So many protein foods are going to be higher in phosphorus. And just something to note there, your animal phosphorus is going to be more absorbable than your plant phosphorus. But the naturally occurring phosphorus, so even if you're comparing an animal phosphorus food to a processed food with phosphorus in it, that animal phosphorus is going to be less absorbable in the body than the processed food. So just to give you an idea here, the natural sources of phosphorus, like your animal and your vegetable proteins, they're only going to be absorbed about 40 to 60% in the body, whereas the additive, the preservative, the processed version of phosphorus is absorbed 90 to 100%. So a huge difference there. Typically, the first thing that we're going to pick on when you have elevated phosphorus levels is going to be those processed foods. So just to give you an idea of some high phosphorus foods that we would want to limit, a lot of fun things are high in phosphorus, so we don't want to have to limit you if we don't have to. So oftentimes those dairy servings, again, are going to be higher in phosphorus as well. Cocoa, beer, dark colas are typically higher in phosphorus. Anything that you eat the whole body of, anything you eat the whole body of, like an oyster, mussels, liver, organ meats, those are all going to be higher in phosphorus as well. And like I was saying, your processed and pre-prepared foods are going to be higher in phosphorus as well. Protein is something else that we want to watch when you have kidney disease, and this is because those protein breakdown byproducts are filtered out by the kidneys. So like we were talking about, your GFR is a calculated number based on your age, your race, your gender, and your blood creatinine level. That creatinine is a protein breakdown byproduct. So the more protein you're eating in your diet, the more creatinine you're giving to your kidneys to have to filter out. So the more elevated that creatinine can be in your blood, indicating a lower GFR. So the standard recommendation is a moderate, low to moderate protein intake with kidney disease. But protein is very important. So we want to make sure that we're not eating too much at any one time, but we're eating it throughout the day. So we're eating some protein at every meal, but we're not going overboard on our protein portions. So making sure you're getting some protein, and you can get the specific recommendations for protein from a dietitian as well. So I always encourage that. And I can't ask this question to you guys because you won't respond, but does everyone know where the protein in your diet comes from? It's largely coming from our animal and our plant protein sources. So if you think about your animal sources, those are typically higher in protein. Plant proteins are going to be things like beans, nuts, seeds, legumes, things like that are going to be higher in protein. Your animal protein sources are going to be complete protein sources. So things like your beef, your eggs, your fish, chicken, your dairy products, they're going to have all of the essential amino acids in there, including soy products. They're also going to be complete proteins, things like quinoa. Pistachios are actually a very high protein source as well. The other protein sources that you might get some protein from, but they're going to be lower values of protein, are going to be things like your beans, your nuts, your seeds, your whole grains. Even things like your fruits and vegetables have some protein there, but typically about 0 to 1 gram of protein per serving, so typically not very much protein there. Vitamins and minerals, you want to be sure that you're getting all of your vitamins, mineral supplements checked out by your doctor, making sure your pharmacist knows the medications and everything that you're on as well. I always recommend that people tell their pharmacist that they have kidney disease and ask if any of their medications can be having a negative impact on their kidneys. You know, your pharmacists know all the medications that you're on. They can see if there's any interactions with them, but they don't typically see any of your diagnoses. So let your pharmacist know what's going on as far as your diagnoses go, and ask them if there's anything as far as your medications go that they can recommend. And if you have kidney disease, different vitamins and minerals, if you're having to limit your food intake, you might be missing out on certain vitamins and minerals. It might be something to consider. But of course, like I said, get that cleared with your doctor. And if you're seeing a nephrologist, make sure you're getting any kind of vitamins, minerals, supplements cleared with your nephrologist as well. They might have a specific recommendation when it comes to different vitamins or multivitamins for your kidney disease specifically. That's everything we pretty much just went over. So a recap of good general nutrition, making sure you're eating a variety of foods. We like to say eat the rainbow, making sure you're not cutting out any specific color group. You're eating all of the different colors of the rainbow, making sure you're getting all of those healthy antioxidants in. Choosing foods that are lower in fat and lower in sugar, choosing foods that are lower in salt, avoiding that salt shaker. Understanding your food labels, which we went over pretty well today, and combining a healthy diet with regular physical activity. Like I was saying, 150 minutes of getting your heart rate up every week, plus at least 2 days of some kind of strength training or resistance exercise. And of course, making sure you're drinking plenty of fluids as well. At least 64 ounces of water is the recommendation. So you're diagnosed with kidney disease. Now what? For one, make sure you know your kidney numbers. See what your kidneys have been doing in the past. What are they doing now? Understand that number. If you're supposed to check your blood pressure at home, please be sure to check it at home. If you're supposed to be checking your blood sugar at home, please be sure to check that regularly, but also just get that blood pressure checked regularly as well. Ask your doctor about your medication. Ask your pharmacist about your medication. Ask to talk to a dietitian. If you have stage 3 or higher kidney disease, your insurance will typically cover for you to talk to a dietitian one-on-one. Understand the connection between your heart health and your kidneys. Have your cholesterol checked regularly and know what those numbers mean. If you're smoking, please stop smoking. And ask to see if you need to see a kidney specialist or a nephrologist. Early detection and prevention are key. Like I said, if we can catch you in that stage 3A or higher, that's where we want to catch you. Try to see what we can do to try to reverse things. If not, it can be managed without the onset of other complications. We just need to see what we can do as far as lifestyle management, see if there's any wiggle room in terms of room for improvement. And nutrition not only plays an important role in your overall health, but your kidney health as well. So keep that in mind. We're not just here for your kidneys, we're here for your overall health. So for more information, these are my 3 favorite resources. So DaVita.com is an excellent resource, and I can tell you why. My favorite thing on their website is if you scroll all the way down to the bottom of the page, there's something called the DaVita Diet Helper. And on that DaVita Diet Helper, you can actually sign up and create your own profile with them. From that profile, you can start to log your food, and it'll tell you how much phosphorus is in certain foods, how much potassium is in certain foods. So if you're needing to limit the amount of phosphorus or potassium you're eating, if you need to limit the sodium that you're eating, the protein, whatever it is that you're focusing on, they have a food tracker there that gives you more information than many other sources do as far as phosphorus and potassium. Kidney.org is an excellent user-friendly website. It's very patient-oriented, so things are very easily digestible. They have a whole tab in there for nutrition, nutrition for kidney stones, all kinds of fun stuff. They have different sources for, they have a different area there that's called Ask the Doctor or Ask the Nephrologist, where you can actually ask a question or see what other people with kidney disease are asking. So I really like that aspect of kidney.org. Excellent resource there. If you like to get into the nitty-gritty of things, if you like more technical information, renal.org is an excellent resource for that. So if you're looking into, specific medications or any other specific concerns that you might have in terms of kidney disease or kidney function at all, renal.org is an excellent resource for that. That's probably where your doctor or your nephrologist might go to get some extra information as well, but a little harder to digest for the layman. But kidney.org and DaVita are probably a couple of my favorites. So obviously we're not taking questions live today, but if you have any questions, my email address is at the front of the presentation here. You can also just leave a comment or feel free to let us know if you have any questions at all. We are here to help you. All righty, well, thank you for listening. I hope everyone is staying safe at home. Take care.